is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with nose ailments that start with the letter N through S. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easy to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions, then I'll move on to ailments of the brain and nervous system. Then I'll address issues with your skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestines, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and ailments specific to men, then issues of the hormones and metabolism. After that, I'll address the issues of homeopathic remedies on infections, infestations in the immune system, then issues surrounding fertility and pregnancy and surrounding childbirth and postnatal problems. Then homeopathic remedies that address special problems in infants, ailments and diseases of childhood, and special issues of adolescence, and finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it's recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or Arsenicum album types, those who react strongly to Arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, Natrum Mur people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, Lycopodium types tend to be tall, gangly, and of a stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. And in reality, each person is an individual. And so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. Now, I'll be making detailed videos on the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with nose ailments. Today, we will continue with nose ailments that begin with the letter N through S. Noses are designed to moisten, warm, and filter air before it is drawn into the delicate recesses of the lungs. With each breath of air, millions of foreign bodies, dust particles, spores, airborne chemicals, viruses, bacteria gain entry to the body. Anything the nose, adenoids, and tonsils cannot deal with passes into the lungs. To function properly, the inside of the nose must be moist, warm, and sensitive. The nasal cavity, divided into two by a septum of cartilage and bone, and guarded at its twin entrances by hair, is lined with millions of blood capillaries and mucus-producing cells. Projecting into the top of the nasal cavity are more hairs, microscopic in size, that trap odor molecules and stimulate the endings of the olfactory nerve. Paired sinuses lead off the nasal cavity. Their function is to add resonance to the voice. Under normal circumstances, they are air-filled, but if their moist linings become irritated or inflamed by infections spreading from other parts of the upper respiratory tract, they fill with fluid, causing the whole area around the nose and eyes to feel tender and congested. Allergies can also cause blocked sinuses. According to one theory, there are 7 primary odor categories, each with its own kind of receptor in the nose. The brain mixes the information coming from the 50 million or so smell receptors in the nose and forms a smell picture. Though human beings are rather poor smellers in comparison with other animals, someone with a good sense of smell can recognize several thousand distinct smells. The olfactory lobe is connected to various structures on or near the lower surface of the forebrain, specifically to areas associated with memory and emotions. Smoking in any condition that causes a runny or blocked up nose impairs sensitivity to smells. Nasal discharge. Intermittent discharge of runny or viscous fluid from the nose brought on by viral or bacterial infection, allergy, chemical irritants, or dry air, all of which irritates or inflames the mucous membranes lining the nasal cavity, and sometimes the sinuses as well. The result is a stuffy, blocked up nose, and also coughing if mucus drips down the back of the throat and onto the vocal cords. Homeopathic medicine regards chronic congestion, not obviously due to any of the causes mentioned above, as a symptom of general toxicity of the body. Mucus is the body's attempt to get rid of toxins that are not being adequately dealt with by the liver or properly excreted by the kidneys, bowels, and skin. Nasal discharge can be a symptom of colds. Watery discharge that then becomes thick and yellow, mild to moderate fever, hay fever, allergic rhinitis, clear nasal discharge, repeated sneezing, itchy eyes and throat, a food allergy, nasal polyps, impaired sense of smell, sometimes facial pain, influenza, aching joints, fever, coughing, headache or sinusitis, pain and tenderness in the cheeks or headache above one or both eyes. It can also be a reaction to spicy foods, dust, cigarette smoke, and other chemical irritants, gas or oil fires, central heating or overly dry air, certain drugs, and cold or damp. A large number of homeopathic remedies have nasal discharge as one of their symptoms, which is why very skilled prescribing is needed to clear up chronic nasal discharge. However, in acute cases, a remedy can be chosen from the following. Specific remedies, to be given 4 times daily for up to 14 days. For profuse, thick, yellowish discharge with the inside of the nose sore and ulcerated and sneezing makes the symptoms worse, use Arsenicum iod, 6C. For sore scabs and fissures inside the nose, made worse by blowing, the sense of smell is so abnormally acute that even the scent of flowers is unbearable. Use Graphites, 6C. For the nose running all the time with constant blowing, and the discharge from the nose is thin and burning, but mucus dripping down the back of the throat is thick, and small ulcers on the septum, use Hydrastis, 6C. For mucus that is ropey, stretchy, and white, with a feeling of pressure around the bridge of the nose, use Bichrom, 6C. For mucus that looks like raw egg whites and the nose is dry and sore, with the loss of smell and taste, use Natrum Mur, 6C. For profuse, offensive yellow mucus, where the nose feels dry and hot with frequent sneezing, use Sanguinaria, 6C. For yellow mucus that smells offensive and the person is very hungry, use Calcarea, 6C. For dry scabs inside the nose that bleed easily, the nose is stuffier indoors than out of doors, and cold sores on outside of the nose, use Sulphur, 6C. For yellow or green bland mucus that is worse in a stuffy room and the person is weepy, Use Pulsatlla 6C. Some self-help. Always blow your nose gently, one nostril at a time, keeping your mouth open. If you blow both nostrils together, mucus may be forced up the eustachian tube and cause a middle ear infection. And if you keep your mouth closed, air may be pushed up the eustachian tube with such force that it ruptures the eardrum. Inhaling hot steam helps to decongest the airways. Do not use aromatic substances in the steam water. If your congestion is caused by dust or pollens, an ionizer may be helpful. If you smoke, try to stop and avoid smoke-filled air. If you suffer from constant congestion, you might gain some relief by sniffing water up the nose to prevent the inside from drying out. Make sure the water is warm. Sniff it halfway up the nose, then blow it out. Do not draw the water all the way up the nose and into the back of the throat, as this may force water into the sinuses and lead to infection. Over-the-counter nasal sprays or drops should only be used if stuffiness prevents you from sleeping or if you suffer from pressurization problems when flying. They can be given to babies if congestion is causing feeding or sleeping difficulties, but make sure they are the right strength and use them very sparingly, as they can damage the sensitive lining of the nose. Vitamin B complex, vitamin C, zinc, and iron are recommended. Nasal polyps. Nasal polyps are a chronic irritation of the mucous membrane lining the nasal cavity. The kind of irritation that occurs in hay fever and allergic rhinitis can cause small protrusions or polyps to develop inside the nose. Lack of zinc and vitamin B6 or a sensitivity to aspirin and other salicylates may be a contributing factor. Though the polyps are harmless in themselves, nasal polyps can obstruct breathing and reduce sensitivity to smells. A large polyp may block the opening to one of the sinus and cause sinusitis. A polyp on one side of the nose only requires specialist investigation and is usually treated by minor surgery. Since there is a small risk of recurrence, constitutional homeopathic treatment is recommended after surgery. Specific remedies to be given 4 times daily for up to 3 weeks. For loss of smell, swelling around the bridge of the nose, nostrils dry, sore, and ulcerated, with offensive yellow mucus, and extremities feel cold and clammy, use Calcarea 6C. For polyps that bleed easily, use Phosphorus 6C. For chronic drip of mucus down the back of the throat and the person feels chilly and weak, use Psorinum 6C. That's Psorinum, Psorinum 6C. For yellow-green mucus made worse by warmer rooms and the person weeps easily, use Pulsatlla 6C. For large pieces of dried mucus and crawling sensations in the nostrils, weeping and sneezing, use Teucrium 6C. For polyps that develop as a result of chronic rhinitis, with profuse mucus that smells nasty and the membranes of the nose are dry and hot, use Sanguinaria 6C. Sinusitis. Sinusitis is an inflammation of the mucous membranes of the sinuses, usually a complication of a viral or bacterial infections involving some part of the respiratory system. It can also be caused by an injury to the nasal bones, dental treatment, swimming, inhaling foreign bodies, or septum deviation. Symptoms are a blocked up nose, nasal sounding speech, and a general feeling of being unwell. If the frontal sinuses are infected, there may be a headache over one or both eyes that is usually worse in the mornings and made sharper by bending forward. If the maxillary sinuses are involved, the cheeks feel tender and pain may be similar to a toothache in the upper jaw. In susceptible individuals, this condition tends to recur, especially in times of stress. Occasionally, recurrence may be linked with a food allergy. Conventionally, it is treated with antibiotics, decongestants, or proprietary analgesics such as aspirin, but the homeopathic remedies given below should be tried first. If these products produce no improvement, then see your doctor. Recurrent sinusitis requires constitutional treatment. Specific remedies to be taken every 2 hours for up to 2 days. For stringy mucus and a feeling of fullness and congestion on either side of the nose, use Bichrom 6C. For throbbing, tearing pain felt deep into the bones of the face with the tip of the nose itchy, use Silicea 6C. For yellow mucus in the face very tender and sensitive and an attack brought on by cold, dry winds, and accompanied by sneezing, and the person feels chilly and irritable, use Hepar Sulph 6C. For pain above the eyes with the nose occasionally stuffed up and yellow mucus symptoms worse indoors, frontal and right maxillary sinuses involved, with jumpy neuralgic pain on the right side of the face, with a tendency to weep, use Pulsatlla 6C. When the condition comes on suddenly, with frontal sinuses affected and the temperature higher than normal and the face is hot and red, with bleeding from the nose, and the symptoms are aggravated by the slightest pressure or by lying down, use Belladonna 30C. Some self-help measures. Avoid dry atmospheres. Humidify rooms and inhale hot steam. Blow your nose very gently. Vitamin C and vitamin B complex, zinc and iron are also recommended. I have a great many videos now on many different topics, and so I've decided to make several different video playlists so that it's easy to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.